NICU nursing is a career where you have the honor of being a cheerleader for the tiniest of lives. You are an advocate, a caretaker, and a shoulder to cry on. With the help of your team, you are called to make big ethical decisions that can change the lives of your patients and their families, but not every decision comes easy. Today, the five of us, Alexis,
Lisbeth.
Maria.
Leah,
Lisbeth. Okay.
present to you our
Grady.
NICU ethics presentation. I will now turn things over to Maria to get us started.
Okay, today we will examine the case of Joseph, a longtime NICU patient whose situation will challenge nurses to devise the best solution for his care and custody while he is entrusted to our hospital. First, let's begin with a broad overview of his case. With that overview in mind, let's go ahead and take a deeper dive into the details of baby Joseph's case and explore the ethical and medical challenges it presents. Okay, so on this slide, we will begin by looking at baby Joseph's case. Joseph was born with multiple serious medical conditions, which include opioid dependence, fetal alcohol syndrome, and a congenital heart defect. After 2 months in the NICU, he showed improvement and a discharge was planned within the next few weeks. However, things took a turn for the worse when his vital signs began to decline. His heart rate increased, his blood pressure dropped, and his oxygen saturation levels fell. However, without immediate intervention, his chances of survival would be severely at risk. Okay, so now let's examine the role of Joseph's parents in his care. Unfortunately, his parents have rarely visited him during his NICU stay. When they do visit, they interact only for a few minutes with the medical staff and they only bring occasional gifts before leaving quickly. Additionally, their behavior raises concerns. Staffs have noted that they smell of cigarettes, alcohol, marijuana, and also they show signs of poor hygiene. These observations raise serious questions about their ability to provide a safe and stable home for Joseph. Given this, we must consider whether returning him to his parents is in the best interest or if an alternative care option should be explored. At this point, Joseph's medical condition is deteriorating. His heart rate is elevated, his blood pressure is dropping, his oxygen saturation continues to decline. Without intervention, his chances of survival are slim. However, another challenge we face is that of foster care options because they're very limited, especially for medical complex infants like Joseph. This presents a difficult ethical dilemma. Like, do we stabilize him to send him back to an unsafe home, or do we attempt to place him in a foster system that may not have the resources to care for his medical needs? This brings us to the central ethical dilemma in Joseph's case. As nurses, we have a duty to save his life, but what happens after treatment? If we intervene and stabilize him, should we discharge him to his parents despite their questionable ability to care for him? Should we seek foster care knowing there are very few options available? What is truly in Joseph's best interest? In response, nurses must take specific actions. First, we should provide immediate treatment. Second, thoroughly document concerns about parental neglect and medical risk. And then thirdly, report the situation to Child Protective Services. And then finally, advocate for a safe discharge plan that prioritizes Joseph's well-being.
For the responses of nurses, when being put in a situation such as this one in baby's Joseph's case, there are a few options of the next steps for the patient. The first option is we don't do anything to stabilize the patient. This is ethically wrong, and discharging him without proper investigating on how the treatment at home will be after getting discharged will be morally wrong, as there are clear signs of neglect given the conditions he was born with. The third option would be to document the concerns of neglect, medical history, medical conditions, and safety risks in the medical records. A third option would be to refer the patient case to CPS to ensure that proper investigation on the parents is determined. CPS will determine if discharge is safe or unsafe, and if it's unsafe, some alternative options would be to seek a temporary custody with close relatives, close local community, thank you, a shelter in local communities and organizations that can properly meet the patient's needs, since foster homes aren't an option in Joseph's case. Lastly, another option would be that a nurse would advocate for the safe discharge plan if temporary placement is unavailable. They could advocate to see if extending the patient's care in the hospital is an option while placement is being found. Some actions that some nurses may wish to have is authority to be able to intervene and have a say on when to discharge the patient. Another option would be the options of family placement options, to have reliable homes for medically compromised patients. And the third option would be community resources that can help parents who are struggling with addiction and provide proper training and care for the child's condition. And the fourth option would be to have follow-up care to ensure that the child's conditions receives care while needed or after needed.
Okay, so next we're going to review Joseph's medical history again, just to look at his conditions from birth to now, just to understand the progression of his health. So what we can take from the information given is that he's around 2 months old. He's a male. There was no allergies stated. He's in the NICU for drug withdrawal and heart defects, and more specifically, as stated before, drug addiction, fetal alcohol syndrome, opiate dependence, and congenital heart defect. But right now we're seeing that he has elevated heart rate, dropping blood pressure, and decreased oxygen. So we want to be able to help him. So by doing that, first thing, the most essential thing is to stabilize baby Joseph so we can help save him. Second, we can administer IV fluids to help restore his blood volume and pressure. We can see that possibly Joseph could have something called hypovolemic shock, which is when there's a significant loss of blood or fluid, which can impair the heart's ability to pump enough blood, as we see here within Joseph's vitals. Next, we also want to be able to provide oxygen because his levels are very low right now. And we want to make sure he has enough oxygen to receive his tissues to maintain the healthy body functions. Next, medications for his heart. We're not given specific details about his heart defect, but we know he has one. So we just want to really monitor his heart, and if necessary, we can administer any medications to regulate the heart rhythm or manage the blood pressure better. And then overall, we just want to be monitoring him throughout the day and watching over his levels carefully, as this is just going to be critical for his health and recovery.
All right, so let's deviate from medical interventions momentarily to address the spiritual and ethical side of this dilemma. Next slide, please. Now that we have fully assessed Joseph's case from a medical care perspective, it's valuable to consider our spiritual values to contribute to the conversation and to keep ourselves spiritually in check. Your input is important, especially if it's a little different, and maintaining a strong connection in your faith is vital in a field where it can be frequently challenged. Knowing what God would say about your patient's predicament can be a great way to decipher your own thoughts on the matter. A great place to start is Proverbs 23:29-32, which tackles the consequences of addiction. In the interest of time, I'll just leave that on the screen. Recognizing how substance abuse is wrong and ultimately comes back to bite you and others in your life is the first step Joseph's parents must recognize before they can truly improve. This truth also reinforces in any nurse that Joseph's parents' habits are unacceptable and not conducive to raising a child. Though Joseph is small, babies can feel lonely and distressed without a parent to consistently hold and care for them. Unfamiliar voices can be a cause of stress in Joseph's already delicate position. As comfort for concerned staff and other family members, we can turn to Isaiah 49:15, pictured on the slide. God has not forsaken Joseph, and we can be comforted that he is keeping him company every minute of this journey. Ethically, this case is no easy one to crack. Hasty judgment can lead to opinions for Joseph's immediate entry into foster care under the impression that his parents will not change. My team and I believe otherwise. The story of the prodigal son teaches the importance of the parent-child relationship and that God's character is all about second chances when accompanied with an honest change and repentance. There's an excerpt of that on the screen as well. Though this story is about a son repenting to his father, I feel the principle still applies. These parents are capable of recognizing their mistakes and turning back to God, and they will be welcomed with open arms if they choose to do so. This story tells nurses not to deprive Joseph from his family unless we know for sure that he is unsafe with them. Now let's turn things over to Giselle to give us insight on how to ethically handle this case.
First off, ethically and legally, we are obligated to act on Joseph. Is a significantly ill, and regardless of what demanding situations in advance, our job is to do everything to stabilize him. Letting him bypass a way simply due to the fact that where he's gonna go, where he's gonna live, and who's gonna end up with, should not be something to justify our medical care. Nurses are obligated to report if there's any incident that may affect that may aware and may cause any suspicions. Uh, they can they can report any symptoms or suspect the child's domestic isn't safe. We have to record it. In Joseph's case, the death of parental environment, the smell of materials, and the concerns about their behavior all prove an unsafe environment. Additionally, nurses can reach out to social workers, CPS, to bring awareness to Joseph's case and make sure he gets the proper care he needs to.
Okay, so in conclusion, as a group, our first priority would be to save Joseph by extending his stay until he's stabilized by our chosen medical interventions that we stated earlier. Then, as we said, a call would be made to CPS to investigate the parents' home before the patient's released, as we cannot judge their fitness of parents as just based on the smell of them. Discharging Joseph into a home we know is potentially unsafe to kill him is ethically wrong on our part. We would not be protecting our patient's best interest. Joseph's parents should be investigated and go through rehab if necessary, as well as possible parental education or training. If the hospital cannot house Joseph while this is taking place, he may go to a close relative temporarily, and a chance should be given to the parents to prove to themselves. But they, as well as Joseph, will need frequent monitoring by doctor visits and CPS, with visits being once or twice a week. If they are proven not to be committed to change, we believe foster care would be the best if there are no other relatives present. It would be beneficial to try to outsource any organization that might be able to care for Joseph. While child having his parents is the ultimate goal, if the parents are endangering to the child, this could help, or this could result in Joseph's death, which we don't want. So we see the situation as a path that will take some time to flesh out rather than a split-second decision. Joseph deserves a chance to be with his family if that is the safe option overall. And then we just have our references, and that's it. Thank you.